Community health centers are economic engines. They have produced over 900 jobs in the state of Arkansas. And as a multiplier of impact, they have generated over $115 million worth of income into the state of Arkansas as a result of their being in existence.
If our center was to close, there would be a lot of people that would no longer receive health care. We live in a rural community where we have many uninsured and underinsured people, and they would simply go without health care.
We really need the community health centers because we have a lot of patients in our community that don't have insurance, that has lots of medical history and issues that need to be taken care of, and because of the insurance, the no insurance that won't be taken care of if the community health centers leave.
The elderly, it would really affect them because it's so much easier for them.
It's a convenience to the area. I mean, a lot of the patients live around the clinic, and it's convenient for them to come to the clinic by walking. We also have transportation services so that the patients will be able to come to the clinic, but they can't afford to go to a regular doctor. They don't have the health insurance. It would really hurt our community if they close this center down.
People would have to travel 25 to 30 miles to the nearest hospital to get services, and they simply cannot afford to go. We have a lot of transportation issues where people do not have transportation, or they have to pay people to take them places, and they don't have the money to do that.
2 years ago, we opened a clinic at Siloam Springs, and if the bill that was just passed by the House goes into effect, all of its cuts, we might not be able to keep that clinic open.
Recently, we had a patient that ended up in the emergency room that was a sliding fee patient. That visit cost him $350. Had we been open or available, it was during the snow is when I'll tell you it was. It was when we were closed for snow, and the patient ended up there for a blood pressure problem. So in order to come and see me, that patient would have had to pay $30. And instead, they got a bill from the emergency room for $350 that they're going to have to find a way to pay.
It would be devastating. We would lose our new access points. We would lose a dentist. We would lose an RN. We would lose a transportation driver.
Basically, 50% of the patients in our area use our clinic. And if we were not there, the only access that they would have to care would be waiting until they get so acutely ill that they'd have to go into an emergency room, which typically is going to be 30, 40, 50 miles away. And then the transportation issues on top of that, it's going to result in significant mortality rates.
Please don't cut the community health center budget. We will show you we're a great return on investment.
It would hurt my family because I do need a job to take care of my family, and because I love my patients so much, it would hurt me because they're hurting.
Please do not pass the cut.
For the health center.
It's for the health center.